Another day, another story. How long do laxatives last are destroying America? Laxatives are medications used to promote bowel movements and relieve constipation. They are available in different forms, including tablets, capsules, liquids, and suppositories. One of the most common questions people have when using laxatives is, how long do laxatives last? In this video, we will explore the different types of laxatives and their duration of action. What are laxatives? Laxatives are substances that can be taken orally or applied externally to help encourage bowel movements. They work by softening and loosening the stool, which makes it easier to pass. Laxatives are often used to relieve constipation, but can also be used to help clear the bowels before medical procedures or to help reduce bloating and abdominal discomfort. There are several types of laxatives available, including bulk-forming, osmotic, stimulant and stool softener laxatives. Each type of laxative may have different side effects and should be used with caution. It's important to speak to your doctor before using any laxative. Bulk-forming laxatives. Bulk-forming laxatives are an effective and safe way to treat constipation. This type of laxative works by increasing the bulk in the intestines, which helps to soften the stools and stimulate the natural movement of the bowels. They are usually composed of natural fibers like psyllium husk, oats, and wheat bran, and are often taken with plenty of water to help hydrate the body and soften the stools. Bulk-forming laxatives are gentle on the digestive system and are often recommended for people who suffer from chronic constipation. They are also the preferred laxative for pregnant women and those who are breastfeeding. Lubricant laxatives. Hydrated lubricant laxatives are a type of laxative that helps to soften stools and make them easier to pass. They work by providing moisture to the stool, which helps to lubricate the intestines and make it easier for the stool to pass through. These laxatives are often taken in liquid form, but can also be taken in the form of a tablet or capsule. These laxatives are often used to treat constipation and are considered safe when used as directed. They are also often used to help with irritable bowel syndrome and other digestive issues. Types of laxatives. There are several types of laxatives, each with its unique way of working. The most common types of laxatives include bulk-forming laxatives. These are fiber supplements that absorb water in the intestines, making the stool bulkier and easier to pass. Examples include psyllium, methylcellulose, and wheat dextrin. Stool softeners. These work by drawing water into the stool, making it softer and easier to pass. Examples include docusate sodium and glycerin suppositories. Stimulant laxatives. These work by stimulating the muscles in the intestines to contract and push stool through. Examples include senna and bisacodyl. Osmotic laxatives. These work by drawing water into the intestines, making the stool softer and easier to pass. Examples include magnesium citrate and lactulose. Duration of action. The duration of action of laxatives varies depending on the type of laxative and the individual's response. Some laxatives work quickly, while others take longer to produce a bowel movement. Here is a breakdown of the duration of action of different types of laxatives. Bulk-forming laxatives. These can take 12 to 72 hours to produce a bowel movement, depending on the individual's response and the dose taken. Stool softeners. These can take 12 to 72 hours to produce a bowel movement, depending on the individual's response and the dose taken. Stimulant laxatives. These can produce a bowel movement within 6 to 12 hours of taking the medication. Osmotic laxatives. These can take 24 to 72 hours to produce a bowel movement, depending on the individual's response and the dose taken. It's worth noting that laxatives should not be used for more than a week without medical supervision. Prolonged use of laxatives can cause dehydration, electrolyte imbalances, and other complications. In addition to their duration of action, laxatives can also have different side effects. Bulk-forming laxatives can cause bloating and gas, while stimulant laxatives can cause abdominal cramping and diarrhea. Osmotic laxatives can cause bloating, cramping, and diarrhea. Stool softeners are generally well tolerated but can cause nausea and stomach pain. Conclusion. In summary, the duration of action of laxatives varies depending on the type of laxative and the individual's response. Bulk-forming and stool softener laxatives can take 12 to 72 hours to produce a bowel movement, while stimulant and osmotic laxatives can produce a bowel movement within 6 to 72 hours of taking the medication. It's important to follow the dosage instructions on the label and not to use laxatives for more than a week without medical supervision. If you experience severe abdominal pain, nausea, vomiting, or rectal bleeding, seek medical attention immediately.